You're welcome back. This is Newsfile. It's your most authoritative news analysis show. And I'm your host, Samson Ladi Anyanini. And I'll shelve my take. We'll talk about it next week. I take on the Parliament of Ghana for its attitude in vetting, particularly judges. And a parliament that has no history of doing what should be a certain scrutiny required of people who go for an interview and which may not serve this country the very best. So we'll do that next week. My guest this morning, seated here in the studio, is Joseph Dindiok Penka, who is MP Timpani and Deputy Attorney General and Minister for Justice. Thank you very much for joining us.
Thank you, Samson.
Also joining us via Zoom, and that will be shortly, Kweku Asare, Professor Stephen Kweku Asare of the CDD Ghana and D&D Fellow for Public Law and Justice. Thank you very much, Prof, for joining us.
Thank you, Samson. Thanks for having me.
Great. Right. We will also be joined later by Godfrey Yeboah Dame, who is Deputy Attorney General and Minister for Justice. But right now, and starting on the issues of coronavirus and how to contain the pandemic in these times, is Dr. John Demasi, lecturer, Global Health Department, School of Public Health, KNUST, and leader, Global Health and Infectious Disease Research Group at the KCCR. Doc, thank you as always.
It's a pleasure, Samson. I'm happy to come to you and your listeners again this morning.
Great. All right, so we have counted to the 6,000 and we are climbing, but the good news we are discovering is that our recoveries are recording a spike to the extent some people are in unbelief, in a state of unbelief that we could record so much, recoveries within a very short time. What do you make of the development?
No, thank you very much, Samson. I think that it is definitely good news to hear that we have recoveries from coronavirus here in Ghana. I guess the question that people are asking is, to what degree is it true that we have people recovering at the rate at which they are said to be recovering? Now, you recall, and again, thank you for the opportunity to bring information to listeners across Ghana and across the world. You recall I mentioned in some of my submissions that I believe that there are a lot more cases or a lot more positive people from coronavirus across the entire country than have been reported, not necessarily because this information is being kept away from the public, but because we are just not able to see or measure the degree to which people are affected. Now, suffice it to say, if that holds true, then one must not be surprised by the numbers of recoveries that are being reported at this time, because the literature and the evidence on the ground suggests that this disease leads to almost 50% plus being asymptomatic. You'll end up with a good majority of people who have this disease not showing any symptoms at all. Mm-hmm. And out of those who may show symptoms, the vast majority will recover. So if in one breath we are arguing that there are so many people who may be infected beyond the numbers that have been reported, then in the same way, we should be able to argue that there'll be a lot more recoveries than the numbers that have been recorded. So that's one issue. The other is you look at the numbers that have been recorded or that have been reported, and you look at the period of time that has gone past, right? And when you have the disease, you are either dead within 2 maximum to 3 weeks, or you would maybe be on a ventilator for a protracted period of time. And we do not have large numbers of people on ventilators. As far as I know, we may not even have 5 people on ventilators, but I must say I cannot verify these numbers. These are just my extrapolations. So if we had a certain quantum of people who were ill or were positive, let's put it that way, from coronavirus at least 2 or 3 weeks ago, all those people who were said to have been positive 2 or 3 weeks ago, by now, if they're not dead, they would be recovered. And that's just what it is.
Okay.
The challenge we are facing is that we're not able to test as routinely as we should be testing because of the limited capacity that we have, both by way of infrastructure as well as finances. So that means that there'll be a lot of people who may be recovered, but just waiting, sitting on the touchlines for a test, or just being held in that isolation center or at home or in the hospital, just waiting for a test result to come through for them to be declared negative, right? So I must say, in all honesty, that there is no surprise regarding the numbers. I personally expect a lot more recoveries, just like I did expect a lot more to be infected.
Okay. So 6,617, we have 1,978, almost 2,000 recoveries. Should we be celebrating this in a manner to suggest that we are on winning ways to overcoming the pandemic?
I think that's a great question, Samson, and you can choose to celebrate for one reason or the other. I wouldn't say that this is a pointer that we are on the winning side or in a winning direction. What it suggests is we have done well by not allowing people to progress from asymptomatic disease to mild disease and then even to severe disease, which will result in death.
Okay.
One thing is clear, and which is that our death rate is low. It is low by global standards, and it is very low even by African standards, which in themselves are low by global standards. Now, talk about celebration because of recovery rates. I think it's good news anytime anybody recovers, and it's a reason for celebration in itself. But the question is, at what rate are people getting infected? You begin to celebrate when you can clearly show that the rate at which people are getting infected is going down. It is going down to a point where you can afford to get people to move about and go about their normal duties without fear of a resurgence in the disease.
Right.
That is the point at which you celebrate. But definitely having so many recoveries, and there will be many more, is good news. You're
right. So we have 245 citizens being deported by Kuwait. So we expect them in the country today. They definitely will be quarantined, as we understand, at the cost of the state. We also understand that you have a huge numbers of Ghanaian citizens who are still, stranded outside of the country elsewhere because of the lockdowns that happened. And the government is looking at granting special permissions for them to be flown back to the country. Is there any danger in bringing in these new numbers of people at a time we are seeking to ease up the restrictions?
No, it's another great question, Samson, and I think we need to draw a distinction between people who are being deported or people who are being repatriated and people who the country would go and collect, to put it, so bluntly, from other countries. My understanding is this group of people are being deported, so it's more like we don't really have a choice but to let them in. But that might even be beside the point. What really matters is that whoever comes in does not put the rest of the population in danger. And the way you go about doing this, which I think has been spelled out pretty clearly, is that you isolate these individuals, or let me not say isolate, you have to quarantine these individuals and test them serially until you can confirm that they're disease-free.
Right.
The good thing is that we have demonstrated here in Ghana, we have the capacity, capability to do this with 1,000 plus who returned on the last couple of flights, and we were able to pick out those who were infected. So at a personal level, I am not worried at all, given that they will be quarantined and will be tested. The risk is relatively minimal. These are people who are being deported. But if I'm to speak to people who we should actively go and collect, people who we should pick up, like send a plane to do rounds on the west coast of Africa or do rounds in Europe and pick up Ghanaians who want to come home because they're stranded, that might be a slightly different question that we could look at in different ways. But ultimately, if the choice is made, then the quarantine would have to be instituted, the serial measurements for infection would have to be instituted, as well as continued follow-up when these individuals are finally allowed to join the rest of the population.
Right. The new vocabulary, living with the virus, the new normal, is what we are getting into now. What does it take to live with the virus and not record, or to begin to open up to live with the virus and not record the spikes that we have seen other countries record as they began to ease up? We have seen, for example, the Electoral Commission issue a poster talking about how it intends to go through a registration process. What do you make of all of that? How do we ensure that when we're easing up, we don't put ourselves in a bigger danger?
Well, thanks, Samson. I think this is a question that everybody is asking at all levels in this country, that how do we get on with our lives in the face of this virus? Because obviously we cannot continue to hunker down and just hide ad infinitum. At a point, we need to lift our heads and make the best of the situation. It's a bit of a tricky question, because you can only answer this when you have a clear visual of what the possibilities are. I'm sure you've seen the reportage from South Africa, where their modelers and other scientists have made projections as to what should be expected if people are allowed to gather and life should return to normal. What should be expected? The question is, we're looking at people being infected, people falling ill, people dying. This is where this is how you need to divide it up. If it's just about people getting infected, we already know that people get infected and majority don't get sick. So if we're able to suggest that many people get infected, but look, this isn't going anywhere, it's just going to be like a common flu kind of thing, that's fine. If we can say that, okay, X number of people are going to go into hospital, but we have the capacity to take care of these people, we have enough beds, even though they may be sick, that's also fine, maybe. But then, if there are going to be so many deaths, that's something that you don't want and something that you cannot take care of, because death is a final event. Now, that being said, you want to look carefully at the deaths that we have recorded in Ghana, which as I've mentioned, have been on the low side relative to Africa and relative to global, and even the whole Africa has been very low relative to global. Now, what is the reason for which we have recorded such a low number of deaths? It is because of our ability to identify those who are positive as quickly as possible, which means that if we enter into a situation where we're not able to identify people as quickly as possible, we will have greater progression to severe disease and therefore greater progression to death, which means that if there is any intention or effort to move back to normal, to open up, it must be combined not only with an increase in hospital capacity and personnel, but also with testing capacity across the board. You want to do the two together so that whoever falls ill on account of being exposed because we're trying to go back to normal should be able to be treated as quickly as possible, to be quarantined or to be isolated as quickly as possible and treated so that the deaths will go down. Now, the reason why I keep harping on death is that it's a very interesting metric. It's a metric which is hard to hide and a metric which is hard to dispute. Because if you look at countries like Brazil, and now Brazil has the second highest number of deaths, second highest number of cases, people are dying by the numbers, even though the government there is making statements to suggest otherwise. People are measuring the rate at which graves are being dug. There's aerial photos of graves being dug open and waiting for people to be buried in there. Now, that's one thing you cannot hide from. If people were dying in masses in Ghana, that's something that nobody can hide. If graves were being dug at an increased rate, that's something nobody can hide. And if there was even an increase in all-cause mortality in Ghana, even assuming we did not know it was corona, we would be able to say, okay, there's more people dying in April and May in Ghana than it was last year, last 2 years, even though we don't know what it is. Could it be corona? And we could, hypothesize. But we don't see any of these figures. So these are things that cannot be hidden. So I have every confidence that the evidence of our death rate being low is clear. What I don't have clear evidence on is our infection rate, because I've kept on saying this over and over again, we're not really measuring this in the way that we should. Now, with all these being said, and easing the restrictions and allowing people to move around, we need to institute, aside from the routine testing across the board, the ability to measure systematically on a daily basis and be aggregating on a weekly basis to see where we are. Because it's when you see where you are that you're able to make decisions and be able to make changes. Now, the question I would ask is, we're going ahead to do elections, looking at December. Come out with guidelines, which are very well known. These are things that are already being practiced. So all the guidelines are perfectly in order. They are scientific. But are we willing, or will we be willing as a country, that as we measure towards December, let's say by October, we realize that things are not going very well. And therefore, if we should have an election, or we should have people gathering for an election, there's going to be a challenge. Will we be willing to say, look, we wanted to have an election, we're planning towards it, but we're looking at the numbers, and at this time, we think we've got to turn back. I realize it's very complicated because you plan for elections way ahead. There's a lot of things you need to put in place way ahead. But I would say that even if the Olympics could be called off at short notice, because the evidence was so clear, and you saw how Japan tried to hold on to the last minute.
That's right.
To just have these elections by all means. But the number, it was clear that this just was not possible. They could not press ahead. Of course, it's different for governments, but I would encourage that, yes, we can go ahead and start planning. That's fine. Put out all the measures and instructions, but also be measuring, and put it also out there that if we measure and we get to point A, point B, point C, point D, these will be what we will do, including options of pulling it off the table, if really there's a need to do so. I don't think it's a do or die situation.
So
we should be guided by the evidence. Right now, there is no evidence to suggest don't do it. There is no evidence to suggest do it. So
the issue coming up is within this same period, we are going to have mass gatherings 2 times or even more. During the registration, you are going to have a lot of massive human interaction and gathering. There's also, after the registration, there would have to be exhibition. So that's another second, mass interaction. And then you will have an election. If you are not lucky and the elections don't produce a presidential candidate, a president, you will do another election. So potentially, we are looking at 4 different occasions when all Ghanaians will have to interact in such massive respect. What are the prospects of the dangers in that?
No, Samson, I like the way you phrase the question, because it really evokes a classic public health disease control, disease spread scenarios. You have mass gathering events over a protracted period of time. The interesting thing is that this even includes travel. So people are going to be traveling across the country to exercise their constitutional right. So there's going to be an increase in movement, increase in gathering. That's your worst case scenario. I mean, this is really what propagates disease: travel and gathering. All right. So this is very clear. But the argument is, what will be the state of coronavirus infection in the country by that time? It is very unlikely that corona would have totally disappeared by that time. If it has disappeared, not that it is impossible, but if it has disappeared, hooray, there's no problem. But if it hasn't disappeared, the question will be, what is our infection rate, or our reproductive number, as we put it? The reason is, if you have a reproductive number that is below 1, and I've kept mentioning this over and over again, it doesn't mean that the disease is not spreading. It doesn't mean people are not getting it. But what it means is that it has not gone above a point for which spread will be exponential. You will have more cases, but the increase will be more linear or even less than that. It won't just rise up. It's not something that will get out of control. So if, let's say, we measure and we have a reproductive number of, say, 0.6, and by holding elections, we're going to move up to 0.8. That means that more people have the infection. It might even mean some people might die. But one could argue that, fine, it's not moving us beyond 1. We're not putting ourselves in extreme danger. We can take this. But if this activity is going to take us beyond 1, that means that we have to go back again to all the lockdown measures and extra measures, and there's going to be a lot more infection, a lot more death. That, for me, might not make it worth it. Okay. So the question is it worth it? It's not as the question is, will there be more infections? Of course, when you gather, when you travel, there will be more infections, but how much? Right. And is it worth the risk?
The suggestion that once the EC does the 6 things that it has announced it will do in the registration process, there ought not be fears of the risk of infections. I want to find out from you if that is really the case. And if that is the case, why is it that at the same time that you, the experts, are preaching that we do all these things, you are still preaching that we avoid social gathering? Number 1, it says you must wear your face mask. There will be temperature checks. I don't know if they check and your temperature is at a certain level, you'll be rejected. There's a constitutional question in that because the Constitution does not allow you to disallow someone of a sound mind and of the age of 18 from voting or registering to vote. Then 3, there will be hand washing. 4, there will be social distancing. Maintain a minimum of 1 meter distance whilst you are in the queue. 5, there will be scanner wipes. And then the 6, there will be sanitizers for the purposes. The question is this a guarantee to catching the disease in such massive gatherings?
Well, thanks for that, Samson. And I'll be just, really candid here as a professional because you asked the question. It's definitely not a guarantee. I can tell you that straightforward. It is not a guarantee. They are only measures which, if followed, will reduce the risk of transmission. You've heard stories of people who self-isolated for weeks and just maybe came outside to pick up a parcel and ended up having coronavirus. They did all the right things. They only picked up a parcel, maybe even disinfected it, but it was too late. So none of the measures that have been put forward, not only for elections, but for any other activity, are foolproof, and they are not guarantees. They're only risk reduction. It is much like, wearing your seat belt, making sure your tires are at the right pressure, and exercising regularly, taking your vitamins, and all these other things which are preventive measures are not foolproof and they are not guarantees. What I would say is that these measures work in tandem with the level of risk.
Okay.
With the level of risk. I mean, if you are riding in a Mercedes-Benz or any other luxury vehicle with all the airbags and with all the safe bells and whistles for safety, and the road itself is riddled with potholes and you're speeding, you can, and most likely will still have an accident. So these are not foolproof, but if the road is good, then all these things come in and their contribution to protecting you from an accident are much higher.
Right.
So we should really return to what is the rate of spread of the disease. Okay. And at the time, inching up to the elections, what is the rate of spread? That should inform our decision. Okay. What I like to see is further mention that we are putting all these things in place. However, if we should get to point A, we will turn back. If we get to point B, we will increase the number of days over which an election can be held. But I realize these are really complicated. I mean, very, very difficult situation. I think it's okay to plan now, but we must be ready if we need to pull the plug, if we need to.
Thank you very much.
I should mention this, Samson. Just one point regarding the spread of the disease and elections. You saw what happened in France. I mean, France took what I think was a wrong decision when the disease had just started spreading to have some local elections. And it had a profound impact on the spread of the disease in that country. this was very clear. But you realize that this happened just when the disease was spreading, which was exactly the wrong time to do these kinds of things. It's a different scenario from us. But it's just to tell you that nobody's kidding themselves.
My final question to you will be your observation of this particular situation where the members of parliament who are sitting here, and I'll ask them that question before we get into the other issues we are going to discuss. They had given us the impression that one of the ways to encourage the nation and rally people around to be open about the virus and not to stigmatize, to be willing to submit themselves to testing, isolation, and quarantine, was that they were going to conduct the test, they will make it open, people will get to see, and it will, you know, affect their psyche. And then when the results are in, they will let the public know, so everybody knows what their status is. Now there is a bit of a U-turn or some decision of sort that says their results will not be disclosed. What's your take on that?
I think that's a very, very interesting question. You know, by law, I mean, you would know better as a lawyer that once medical records, you know, fall under the Information Protection Act or whatever law, where you just cannot disclose someone's medical records unless they explicitly want it so.
But a public health emergency, as declared by the state, through EI 61 and public safety purposes, that can be an exception to that rule that your record is confidential.
Absolutely. No, absolutely, Samson. I was just developing a point right there.
Please go ahead.
I was just trying to point out that you know, every individual has a right to hold their results back. But I thought that it was really a brilliant suggestion in the beginning that this would be done. But it would have a greater effect if it turns out that some were positive and some were negative. Not that I wish any of our honorable members to be positive, but then it would have such an effect for people to see that, hey, we've got people who are the helm of affairs, some are positive and some are negative, and they are out there with that information. However, if it turns out, and most likely will be the case, that all of them are negative, I'm not too sure how that would really increase the impact of that intervention. Nonetheless, I would, on a personal level, really encourage our members of parliament that if they are able to, this would be a big statement across the divide, both in the government and the opposition, to demonstrate that, look, this is all of us together. And we have our private lives, but we're willing to open up our private lives in the interest of the nation to let you know and understand that you have to get tested, and it's okay to make your test results known to your loved ones and to people close to you. And because we are your leaders, we are close, you are close to us, you mean much to us, and we're willing to share with you our private lives by way of our results. So I think it could have a great effect. I'd encourage them to do this, but you know, they have every right to choose not to.
Okay. Thank you very much, Dr. John Demasi, lecturer, Global Health Department, School of Public Health, KNUST, and leader, Global Health and Infectious Diseases Research Group at the KCCR. Thank you very much once again, Doc. Right.
Thanks, it's a pleasure.
Yes. So let me pick your views briefly on this, and then we take a break. We come to visit the Auditor General's, office, and then after that, we will try to examine the Amidu report. Not try, we will actually examine it into detail today. And you have the former Deputy Attorney General here, you have present Deputy Attorney General here, and you have another present Deputy Attorney General who is joining us on the line. So get ready and enjoy this. Professor Stephen Kukwasari is also on the line. If you have been reading, he also has a very interesting view. That view supports the minority view and sort of tells the majority that they were so wrong in the manner in which they proceeded with the Amidu age decision. Now, let me start with you, Professor Kukwasari. What do you make of the members of parliament the decision that we are getting to know now, that their test results will not be made public. What is the impact of that on what it was supposed to serve, to encourage more people to not run away from isolation and testing and stigmatization?
Samson, thank you very much. I think the doctor you had before spoke eloquently to this issue. I like to talk about things that I think I know a little bit about. I don't know a whole lot about public health issues. I know that as a matter of law, people have an expectation of privacy to their health record. And so I don't want to wade into something that I lack the technical competence.
So let me ask you on the legal side. Should the privacy be upheld even in a public health matter? I have the right, according to Article 18 of the Constitution, for the privacy of my correspondence and communication not to be interfered with. Because of this pandemic, by virtue of EI 61 and EI 63, I have lost my privacy. What are we talking about?
Well, obviously we are in an emergency situation. And I would add that I don't think the emergency has been properly declared, but we are in one. And once you are in an emergency, then the government has the power to do certain things, but it doesn't mean it has the power to do everything. So while they could interfere with your communication, which I don't think a good case has been made, it doesn't mean, for instance, they could expose your health record. It doesn't mean, for instance, they could take your life. So the issue then is of the plethora of rights that people have, which of them is the government reasonably allowed to interfere with in an emergency? I believe that's the way we got to balance the issue. So certain things they can stop us from doing. For instance, your right to worship can be temporarily interfered with. But I don't think the government should then have the power to go into my medical records. That would be going too far, I think.
Okay, so hold on quickly. Why are you guys not ready to, encourage your constituents and the whole nation to be hooked up to the idea that it's okay to get tested, it's okay to get isolated, and so on. It's okay. It's unfortunate if you get tested, positive, but is it negative, positive, but you might get healed.
Samson, thank you very much. I have listened already. We've listened to two persons this morning on this vexed topic. And let me state preliminarily that this matter is one that is novel. All of us are aware of it. And we'll have to also find novel ways of dealing with it, or as it has come up as a novel situation for all of us to grapple with. But Samson, just to be simplistic on this matter, assuming that in constituency A, somebody, the MP goes to test, and you declare him to be positive. Now, you announce it to the whole world in a society where there is so much stigma and stigmatization for that matter. And that man gets back to his constituency. And you are
seeking to beat down the stigma.
Yes, we are seeking to beat it down.
Go ahead, and that man gets to...
Of course, so he gets to his constituency, and because of this element of stigma and etc., you can imagine even in the midst of what is happening, the election year and etc., what is going to happen to the person. In some parts of the country, the person is out of public service. I can tell you, there's no dispute about it. Because it's going to be, people will even incite others that when he's coming, run away. That's a statement of fact I'm telling you.
That's what you intend by your openness to avoid.
Yes,
to discourage.
So you see, the point is this. What we have to do is to balance this in a manner as not to affect even, look, that can even affect the health. It can deteriorate the health of the person who is tested positive.
Your opponent may even converse that you should not be voted for.
You see, all that I think...
You are a candidate of death.
Yes, I think what we should be doing rather is that we should continue to maintain the situation, confidentiality of health status, but ensure that the safety protocols as enumerated by all the health professionals are strictly adhered to. But one thing that frightened me a little bit this morning was when I listened to the professional. He sought to say that, yes, it is just to minimize the rate of spread if we go through the safety protocols and etc. But I thought that is rather meant to ensure that we don't contract it. If I wear the mask, I sanitize, I wash my hands, I practice social distancing and etc. I thought that is meant to ensure that I don't contract the disease at all.
Yes, so that's the same thing he said.
No, he didn't say so. He said that it's only meant to minimize the rate of the risk of spread.
Right.
But I thought that that is not what I have been understanding all this while.
So he's the expert. He should listen to him.
That's what I'm saying. I thought that all this while that is not what I have understood it to be.
All this while I have understood that whilst I practice all these protocols,
uncontracted
protocols,
yes,
I should avoid gatherings. It is the reason that we have a law that has banned gatherings.
But that's why something, I don't know, you are going back to the same thing. What I'm saying is that you practice social distancing, you sanitize, you wash your hands.
You reduce the risk of infection.
You wear your mask at all times.
Right.
What is the purpose? Is it not meant for you to ensure that you don't contract the disease?
Reducing
is that not the
fundamental
risk?
Reducing the risk.
The fundamental reason for all this is to ensure that you don't contract it.
Reduce the risk.
No, but
like the experts have said over and again, and the World Health Organization has emphasized these practices are not a cure. They are only to reduce the risk.
Yes, of course, we're not saying it's a cure. In any case, I mean, you don't cure it by wearing this. It is to prevent you from contracting. That's what I understand it to mean. That when I practice these safety protocols and etc., it will prevent me from contracting. But from what
it will reduce the risk of contracting. Let's keep to the medical, explanation.
Yes,
which is general across the globe.
So yes,
right.
Assuming even that I agree with you totally that it will reduce the risk of infection and etc.
Right.
Ultimately, the purpose of this practice by all of us ensure that we don't have it. Ultimately, that is why we are going through all these protocols. This morning, I have had to sanitize. My senior at the bar had to sanitize. When we got to the reception we did, we had to wash our hands and all
we may do it many times before we leave here. This very desk gets sanitized over and again.
You see, there's something that I want our health professionals to actually advise us. And this is it. Now, assuming that we come to live with COVID-19 as malaria, for the rest of our lives, what do we do?
Yeah. Okay.
Assuming COVID-19 becomes malaria, what do we do for the rest of our lives?
Dominic, before you guys got tested, we had some of you speak so positively and emphatically, including Ras Mubarak, that what you intend to do is part of the process to reduce the stigma, discourage those who are running away from getting tested. We are told of people who are just running away. They don't want to be tested. They don't want to be isolated.
Yeah. Oh, something, I don't know what has informed leadership's decision to, reverse themselves on this matter.
You don't support it?
It's not that I can't, until I know the reasons given by leadership, I cannot, declare whether or not I want to support it or I won't support it. But what I have to say, in addition to the views that my colleague has just, put forward, is that we need to be careful because you don't have an empirical basis for asserting that either taking the test, or even announcing the results will have an impact on the public perception of the nature of the disease and then what your followers or your constituents will do. For instance, I would have expected a situation where...
No, but that's a natural consequence. That's taken for granted.
No, why is it that the fact that
you are such huge role models that once they see that you are doing this and they would definitely follow.
But something, why is it that when the people of Bulgaria know that their MP has been tested, they cannot, because of the fact that I have submitted myself to the test, be encouraged that, oh, after all, our MP has gotten tested,
right,
and therefore we should be, this is something that we can do, and also, continue to live a normal life.
Right.
I think that should be sufficient. But of course, I do agree that if the test results are made public, it will engender public confidence in the testing. But of course, we need to also look at the natural and foreseeable consequences, of making the results public. And as my learned friend has said, if you are, in a contest, in an election year, and then let's say for the sake of argument that I have tested positive for COVID-19, my opponent is on the ground, maybe because he is not an MP, he has not submitted himself to a test. Maybe he's roaming around with COVID-19.
Yes.
But he will go around saying that, look, this man is a candidate for death because he has tested positive for COVID-19. And so if you vote for him, it's most likely that there will be a by-election before or after the election.
The idea is that you think of the greater good.
Yes, we think of the greater good. But the question, my problem is that what is the empirical basis for asserting that going all the way to the publication of the results, all right, will engender more public confidence in testing.
Okay.
And then will reduce the stigmatization.
Right.
At least we should have taken maybe a sample, a survey of constituents. Will you want your MP to get tested? And will you want his results published? And if the results are published, will that encourage you, to go get tested, or that your perception of COVID-19 will change?
Okay.
If we had that kind of survey, sorry, I think my mask is impeding my ability to speak. If we had that kind of empirical evidence or a survey report that would have informed Parliament's decision whether or not, and the extent to which we can go with this matter, because you see, as Professor Koko Asare has said, and I think you even mentioned Article 18, all right, our privacy is individual to us, all right. It is not something that somebody can waive. So leadership cannot just come and say, okay, it is okay to announce the results of everybody. Some parliamentarians may go to court to try to stop them.
Okay.
Yeah.
All right. All right, so we take a break here, but before we do that, one message from Kwame Sapong Esiedu, whom you have heard on this show a number of times, also assisting us with the COVID discussion. He says, stress. Taking all the precautions like social distancing and hand hygiene are not to ensure that you don't contract the disease, as they are not foolproof. These are risk minimization protocols. Sometimes even the inappropriate application of these risk minimization protocols, like improper wearing and removing of the mask, can increase risk. I think many see these as foolproof, but they are not. We'll be right back, visiting the Auditor General's department to ask why over 130 MPs, former MPs a decade ago, government appointees, some of whom are in government now, some back in parliament now, including former presidents, including dead MPs, seeking about 30 million Ghana cedis as salary arrears, allege. The Auditor General has advised the presidency to reject this. We'll find out, including from Osei Mensah-Bonsu, who is also on the list, whether his justifications are founded. Of course, there are ghosts all around the public service, and they are seeking, and they have been paid almost 600,000,
400,000, 424 million.
Yes, they have been paid a lot of money. We'll be right back.